I'm going to continue my entrance-based discussion of the topic orthodontics. And today, I'm going to talk a little bit about fixed orthodontics. Before going into fixed orthodontics, I would just love to start with a small story. It's very simple, not a big deal. A woman is driving in her car on the road. A woman is driving in a car on the road. A man is driving in his car coming in the opposite direction. Woman driving in one side, man coming on the other side. Once they reach together, when they come close to each other, this woman suddenly, for no reason, shouted at this man, donkey. She just rolled down the glass and shouted down, donkey. My God, this fellow was so furious. He got so irritated. Like any one of you, even myself will be really infuriated if somebody shouts out donkey on face. So what will you do when a situation like this comes? This man did what I would have done, or many of the people here would have done. He just shouted back monkey and many other words, which I don't want to shout. I don't want to talk here. When she just went by. This was a fraction of a second. It just happened and she went by. He was like proud of himself. In that fraction of a second, he could come out with so many bad words. He was proud of himself and he started driving forward. He went forward, and when he took the first curve on the road, this is what happened. There was a donkey on the road and she was trying to help him by shouting donkey. But did anybody sitting here think that way? We think, oh my God, a female looking at me and shouting donkey? You think in a different angle altogether. Why? That's how our minds are set towards certain things. Guys, have an open mind. Have a mind ready for changes, because I'm talking about orthodontics here. Orthodontics, fixed orthodontics. Come on. You need a big mind change to appreciate it, to understand that. So my topic is fixed appliances, which needs an open mind. And when it comes to entrance, it's no different. Until and unless you know some basics, it's very difficult to answer the NEET or the National Board or Australian Dental, whatever question you come across. It's not that easy. So that's why I wanted to start off with that. And then my philosophy of 15 minutes of discussion, you should be able to get 15 minutes of explanation by a faculty. You should be able to answer 5 MCQ questions. If that's the way you approach entrance exams, guys, it's not that tough. It's not that tough at all. And the team focus is ready for that. And team focus is equipped with that. You just look at the caliber of the faculties of team focus, you will understand what all they have achieved. There are people who achieved Kerala entrance, and myself have done National Board Part 1, Part 2. So there are people who have done all this, guys. Just be there and be ready to learn. We can make a big difference. By the way, I would like to request people to come in videos, please. I hate talking to my computer. Already told that multiple times. Dr. George, I think when our main classes come, I will make it mandatory that the video has to be switched on. Okay, now it's not mandatory. These are like free webinars. Now it's not mandatory, but in the main classes, Dr. George, what do you say about that?
Yes,
yes. My daughter in 10th standard, 11th standard, it's mandatory that the video has to be switched on. Yeah, why can't I focus entrance coaching with the video be switched on? It should be switched on mandatory. Not today. I'm talking about the main classes. What do you say, Dr. George?
Yes,
Let's plan that.
as
Let's
we
plan
see
that.
on the
Yeah.
videos, we have much more energy to teach because we can, rather than speaking to a non-living computer, we can at least see the faces and see the smile on the faces. Yeah.
Exactly. And
Oh, that's
see
great.
and see
All
the
our slides are
yawning
good.
on the faces. See
Good.
everything possible on the
Yes,
faces.
yes.
Yeah,
So, like,
let's
we can see a lot of positive faces here. That's what
yes,
I would
that's what even I like to
notice.
see. And so okay, good. Many people have come out with videos. Thank you so much. So that's it. Let me just go quickly into my topic, fixed orthodontics. Now, fixed orthodontics needs a little bit of history. History is boring, as you all know, but you have to know certain names like Pierre Foucault. Pierre Foucault is considered as the inventor of orthodontics. Guys, an entrance question, I have seen this question, who is the inventor of orthodontics? Not father. I'm sure you've heard all this father, grandfather stuff. This is inventor of orthodontics, okay? That's a very tricky question I've seen. Keep in mind, Pierre Foucault is considered as an inventor of orthodontics, not exactly father of orthodontics. There are some textbooks saying he is considered as a father of orthodontics too. So please keep that thing in the mind very clear. Pierre Foucault can be called as inventor as well as father of orthodontics. But we have an entirely different category coming up soon. I will talk about it. This guy way back in that year with those wires and all that moved teeth. And then Dr. Begg, Australian orthodontist, Dr. Begg with his Begg technique, pin and tube technique. Remember these words, pin and tube technique, Begg technique, ribbon arch technique, multiple names that can be given to this particular technology. Dr. Begg. Why am I specifying Begg is because questions are coming in MCQs related to this. With that single slot bracket and a brass pin, the wire is put in and he moves teeth. But what are the problems with Beck technique? The biggest problem with Beck technique is it's a huge slot. Okay, guys, it's a huge slot with a thin wire inside. Too much of play. That when you move the teeth kind of tips like that. That's called uncontrolled tipping movement of the teeth because of too much of play there. That is the biggest problem with Beck technique. You get to see all these kind of results with Beck technique. And then Dr. Beck improvised on that by adding on to uprighting springs and all that, but many were lazy to go into that stage. So the Beck technique lost its popularity because of that. Then Dr. Angle, Edward Angle, in America, in Australia, all these things were going on parallelly in America. Angle came with something called as E-arch. E-arch was the first thing that Angle came out with. And then he improvised on E-arch and he got this Edgewise appliance. Guys, listen carefully. Just because he got Edgewise appliance, he's considered as the father of modern orthodontics. So Pierre Foucault can be father of orthodontics or inventor of orthodontics, but Angle becomes the father of modern orthodontics. Very, very common question in any platform. Who is the father of modern orthodontics? Dr. Angle. What are the problems with Edgewise? See, what Dr. Angle did is that Begg round wire he made into rectangular wire. The Begg round slot, he made that the round slot of the Begg he made into horizontal rectangular slot. So now you have a rectangular slot, rectangular wire going in like that. That's what Angle did. He completely changed the configuration. Round wire to rectangular wire. Now, what is the problem with Edgewise? Every technique has its own problems. What's the problem with Edgewise? Problem with Edgewise was you put a rectangular bracket, rectangular wire, move all the teeth moves flat, flat. All the teeth moves flat. It's called flat smile. Flat smile was the biggest controversy at that time with Edgewise Appliance. What do you mean by flat smile? All teeth in same level. Because the same bracket for all the teeth and all the teeth moves to the same level. Guys, just go back to your prosto first year BDS. First year BDS prosto teeth setting. Don't you remember that time? How many years you have to go back? I have to go back almost 30 years. How much of a year you go back, let me tell you, you will not forget those times of prosto teeth setting, walking around with an occlusal rim and the teeth set and taking some wax out and putting a teeth there and trying to get the signature. And when you get the signature and then you put the next teeth, the sir says, remove both. Sir, the other one you already gave me a sign last day, remove both. In Manipal, we used to have people who throw it out of the window and we used to collect it lunch break from ground floor. Guys, I am talking about what are they trying to do here in prosto. Every teeth, every ideal smile has something called as a smile designing. That is, number one, every teeth has a horizontal relationship. Some teeth out, some teeth in. In simple terms, central incisor, when you compare to lateral incisor, central incisors are slightly out. Laterals are slightly in. Canines are out. Don't you remember that? So, that is the biggest issue with Edgewise. All teeth will be flat. There's no in and out. That's called in and out in orthodontics. And for in and out, what Dr. Angle did is he started doing wire bending. This first order wire bending. First order wire bending. Look carefully here. Look at that small bend given to the lateral. So the lateral will be slightly in compared to the central. That's called first order bend. Then second order bending is that angulation. Every teeth is not the same. Both centrals are not like flat like this. It's slightly angulated. Slightly angulated. That's a second order. That's a vertical. The first one I talked about are the horizontal. Now you compare all this with your prosto. Compare with the prosto. Look at the teeth setting from the occlusal view. You can see the horizontal in and out. Look at the thing from the front view. You can see that slight tilting of each teeth. That is a second order bend that has to be given to each teeth to get those bends. And then the third order bend, that's called torquing. Very tough, guys. This is not very easy here. This is hi-fi stuff in orthodontics, torquing. Torquing is every teeth has an angulation. Central angulation is different from lateral angulation. Canine is more upright. Central is more like this. Lateral is little like this. And the canine is upright. Don't you remember in prosto, the professors used to tell you, push the neck in, push the neck in. Do you have any idea what that fellow was talking about when they said push the neck in? He was talking about correcting the torque of individual teeth. That is done in Edgewise technique by using wire bending. Individual bracket area in the wire, you have to twist the rectangular wire and look at a close-up of this. Look at this. The wire is not going in straight into the slot. Wire is going in slanting into the slot to give the corresponding torque to that particular teeth. That's the torquing. Then came straight wire appliance by Dr. Andrews. By around 1970s, Dr. Andrews came out with straight wire appliance. That was an innovation in dentistry. Dr. Andrews was a poor wire bender. He never wanted to do this first order, second order, third order wire bending. He wanted something different. You know what he did? He modified the bracket. He modified the bracket in such a way that you don't have to bend the wire. The bracket has changes. Let's look at this. This bracket, if you look carefully, has a small inclination of the slot. Look at this bracket, severe inclination of the slot. So All you have to do is to put a straight wire in. The teeth will get its required movements. That's called straight wire technique. No wire bending required. Straight wire technique by Dr. Andrews. Amazing concept. No wonder he's called as the father of modern orthodontics. He revolutionized orthodontics, including torque. Look at that. Instead of that straight going in, the bracket slot is designed in such a way that you just have to put a straight wire in like that. The teeth will get the required torquing. That is what Andrews did. Now, the biggest issue here was every bracket is different. Upper central incisor right bracket is different from upper central incisor left, because the inclination is opposite. You can interchange the brackets. In Edgewise or Beg, you can put any bracket onto any teeth and move teeth, and the finish was with wire bending. In straight wire, the finish is with bracket positioning. Earlier, best wire benders were considered good orthodontists. Not anymore. Remember in your undergraduate time, first year BDS, second year BDS, you used to tell your friends, oh, you will become an orthodontist. How nicely you're making a square, rectangle and all that. Wire bending is not the criteria now. Now, whoever is the best bracket positioner, they are the best orthodontist, not the best wire bender anymore. Quickly, let's go see some questions related to this. Guys, this is just 15 to 20 minutes and questions, okay? A lot of stuff to learn here, which we'll be explaining step by step in our micro sessions coming up. Do not worry. I know I'm going a little quick, but these kind of topics, guys, are so simple. You guys worry about big stuff. You have pathology. You have all sorts of stuff going on. Ortho, guys, it's nothing. Just listen to all this. And the best part about the team focus is all of the departments are so gelled together for the last 5 years. That is the beauty I found in focus. I just joined focus a couple of months before. But I found out that last 5 years, that bonding they have with all the faculties, that interaction they have every week, 2 staff meetings. Guys, these guys are doing something like Byju's app, I would say. That kind of dedication going on in this area of how to improvise entrance education. Hats off. Now, Edgewise bonded brackets. Okay, let's see like this question. Edgewise bonded brackets are used. Answer A is on incisal edge of anterior teeth. Incisal edge of anterior teeth. Option number 2. See, no brackets are put on the incisal edge anyway. So this option doesn't look sensible at all. To obtain edge-to-edge occlusion, no, edge-to-edge occlusion is never an aim in orthodontics. So that answer also doesn't make any sense. With rectangular arch wire, remember I told you Edgewise uses rectangular arch wire. Answer C seems to be correct to me. But let's look at answer D. With labial arch wire at incisal and gingival edge of each bracket, no, doesn't make any sense. So the answer obviously is C with rectangular arch wire. Next question here is the first orthodontic appliance devised by Angle. First orthodontic appliance devised by Angle. Can somebody come to the chat box and tell me the answer to this? Not A, B, C, D. Come on. I haven't put the choices. But the first orthodontic appliance by Angle. I just told that actually in the E-arch. Oh, perfect. You guys know everything. Yeah, I want to go fast. You guys know everything. Yeah, perfect. So Edgewise, no. Edgewise was not first Angles device, pin and tube. No, it is with the peg and the E arch is the correct answer. Ribbon arch is also a modification of the ribbon, pin and tube only. So the answer is E arch. Perfect. In Edgewise appliance, answer A. This is from the national boards. First order bend is given in horizontal direction. First order bend is given in horizontal direction. That's true. I told you about the in and outs. So that's first order, that's horizontal, that's true. Second order bend is given in vertical. Yes, it's in vertical direction. Second order bend is in vertical direction. Third order bends are placed by twisting the wire. Yes, the wire had to be twisted so that it goes into the bracket and gives the torque. All three answers seems to be correct. So the last one, all the above are correct, is the answer for that. Father of modern orthodontics, I covered that. Angle, tweed, purificard. Yeah, to confuse you, purificard can be there. And peg, yeah. So the answer obviously is Edward Angle. Straightware appliance was developed by. Straightware appliance was developed by. You want somebody to answer that? Gayatri said Andrews, but Revati said Beg. No. Revati, no. Yeah, Andrews makes sense. Yeah, A, Angle, B, Andrews. Andrews makes sense. And then Beg and the Panchers, they have their own thing. So that's Andrews is the correct answer. Straightware appliance was developed by Andrews. Quickly going through the armamentarium. The newer trend is showing a lot of pictures and asking you to identify the appliance, identifying the instrument. Newer trend is that in NEET. So look carefully. Question number 6. What is this? You want somebody to type in what is this quickly? Nobody knows what this is. Modules. Yeah, that is exactly what they also want to know. Modules. These are not modules. Okay, if you look carefully, these are called separator elastics. Those are bigger ones than the modules. I'll talk about modules pretty soon. Give me some time. But somebody answered ligature wire. I don't know. I didn't show any wire there. So it looks like module. It's very confusing. The answers can be module, but it is separator elastic. Separator elastic. Then another question, another instrument. What is this instrument? This is a separator elastic plier. Separator elastic plier is a very common question. Why? This is so commonly used in pediatric dentistry also by pediatric dentists. So this can be a question in your pedo as well as ortho. So for all that band and loop and all the space maintainers, whatever you want to put bands on, you need to separate the teeth. So this can be a very common question. Separate elastics or those blue elastics which we use to put. Somebody answered Matthews player. No. Separate. And then question number 8. Any idea? This is there in textbook biology also. Come on. It's a very common, it's a very old tool. Nobody uses these days. This is a separator spring. Separator spring. This is also used if you do not have an elastic or the elastic is not going in. You can use this spring and put between the anything from top and bottom. Teeth will separate. Whether it's elastic or spring, it will separate. Now, next thing is question number 9 is identify this appliance. This is a band remover used to remove bands. Again, used very commonly in pediatrics as well as orthodontics. Band pusher is pushing the band in, is a band pusher. Not a very common question. I've seen it in an Australian board exam. I saw this question. So I just thought I'd just give all the armamentarium here. And then the plastic handle, the band biter, it's called band biter. You ask the patient to bite onto it, the band slowly goes in, band biter. Okay, now comes the plier used to put the module. It's called as Matthews plier. Matthews plier, it's a very common question. Matthews plier is used to put modules, used to put ligatures. That's Matthews plier. Can somebody tell me what this is? If everybody knows this, guys, I'm stopping this here. Distal and cutter, deep Rajan. Distal and cutter. Bracket placer. No, it's a distal and cutter. Dr. Deep Ranjan has said that correctly. This is a distal end cutter to cut the distal end of the wire. You can go all the way back inside and cut it. So that's a distal end cutter. It has a 90-degree angulation so that you can nicely go inside and cut it as a distal end cutter. Question number 14. Anybody wants to guess on this? What is this? Identify this can be a question. It was a question many years before. Recently, I haven't seen E-chain. Perfect. So that's called elastic chain or E-chain. Now, if they want to confuse you, they can talk about E-chain has something called as continuous, short, and long type of. There are 3 types of E-chain. Continuous means this. After one loop is the next loop is the next loop. Short means there's a small distance between the loops, and the long loop has a long elastic chain has a bigger distance between the loops. That depends upon the inter-bracket distance. So upper arch normally uses long, lower arch normally uses short. But continuous can be used anywhere. So just want to let you know the varieties of elastic chain also. Okay, now question number 15. Somebody wants to give a try. Question number 15. Somebody wants to give a try. What is this? Molar tube. Perfect. Now molar tube, no bracket, no. Reshma, it's not bracket. It's molar tube. Perfect. But in molar tube, the question can be confusing here, wherein it can be called as a bondable molar tube or a weldable molar tube. Bondable molar tube has this mesh, so that you can bond onto the teeth. Weldable molar tube are welded onto the molar band, which can be the next question. What is the answer? Identify this can be the next question. Anybody wants to give a try on what is this next question? Identify this. Molar band. It is a molar band, but question can be, the choices can be very confusing. These are called as preformed molar bands with molar tubes. Preformed molar bands with molar tubes. So the molar tube, which can be bonded like that or banded like that, there are 2 types now. Please understand that. Yeah, weldable. Good. Dr. Akshada said that. Weldable to the band or bondable to the teeth. There are 2 types. Okay. Now, this is the molar bands, preformed molar bands coming in the kit with multiple sizes, because once it's preformed, it won't fit everybody's teeth. So you'll have to have different sizes for different people. Now coming to bracketing quickly, how do you do the bracketing in straight wear? You do etching first, dry it off completely, wash it off, dry it off, get the etch a frosty surface, apply the primer, apply the bonding, and then apply composite to the base of the bracket. Apply composite to the base of the bracket. Now, that can be a question. This was a question last year in NB. Identify the appliance. That is a bracket holder. You hold the bracket from the kit using this. And using the holder, you put it onto the teeth. Now, to make you more confusing, there can be a very irritating question that can come. It was there in the Canadian board last year. Before going to that, there's a question number 18. Direct bonded orthodontic stainless steel brackets. Direct bonded Orthodontic stainless steel brackets derive retention with the composite because of the mechanical interlock with the mesh at the bracket base. Yeah, that is actually the correct answer. It's just a mechanical interlock with the mesh. There is no chemical interlock. There is no mechanical and chemical interlock. There is no biological interlock. It's just a mechanical interlock. Question number 18. Question number 19 here. That can be a tricky question. It was there at the Canadian board, if I remember correctly, last year. One picture like that and asking a question. Explain a scenario where you fix bracket onto the cast. If you look carefully, the brackets are fixed to the cast. Can you see that? It's fixed to the cast. Why do you fix a bracket to the cast when the patient is sitting there? You're fixing the bracket to the cast. Can somebody here come to the answer on that? Why is a bracket fixed onto the cast? Nobody? It's a little tough. I know it's a little tough. Do not worry. If you don't like that conventional bracketing method, study model, in a way, but that's not the answer exactly. In a way, you take a model, and in the model, you draw the long axis, this, that, and place the bracket in the correct positioning with special glue. After that, you make a vacuum former out of it, And that vacuum formed one. When you remove the vacuum former, the bracket will be inside the vacuum former. And now what you have to do is put that vacuum former inside the patient's mouth. At all the teeth. Apply primer on all the teeth. Apply composite on all the bracket. And put the thing in, ligature the whole arch and remove that plastic tray. All the brackets are in there. This is called indirect bracketing. What we learned earlier is direct bracketing. You fix it. That can cause a lot of bracketing errors. This is called indirect bracketing, where there are no errors because the bracket is done by the lab guys on the exact perfect positioning. All you have to do is put it in, ligature, remove the plastic tray, all the brackets will be there. That's called indirect bracketing. Question number 19. Question number 20. You want somebody to, somebody can talk about this. Question number 20, identify this gadget. Question number 20, identify, I'm almost done. I promised 5 questions, 5 questions here already. Moons, no, it's not moons exactly, but you're almost there, Dr. BNSH. You're almost there. It's called Boone's gauge. Boone's gauge, Yogita, you got it. Boone's gauge or those gauges used to put the bracket in the right place in direct bracketing. You're talking about direct bracketing here. Boone's gauge is used to find out the positioning. Central incisor 5 mm from the incisal edge, lateral incisor 4.5 mm. So all that minor changes can be adjusted with this Boone's gauge, with this device called as Boone's gauge. So that can be another question that can come. Now, this is the elastic module, the module you're talking about, the color modules you're talking about. Module comes in multiple colors. This is also a question at least 5 years before. I haven't seen this question coming recently, but you never know. They can take, these people putting questions are crazy, guys. They can put anything they want. You should be knowing, yeah? So this is elastic modules there. Elastic, the correct terminology for that is elastomeric ligature. Ligature wire is like 0.010 thin ligature wire used to tie the wire to the bracket. We are talking about elastomeric ligature. So this is the elastomeric ligature. That is the Matthews plier. And you take it with this and put it into this. That's placed like this. Guys, today I had a patient. Doctor, I'm not wearing my uniform for last 1 year. It's online classes, but I wish I get module colors in my uniform color, please. So put alternate blue and black or dark blue or whatever. People are crazy, guys, but you should be knowing about all this. And there is a new stuff called glow in the dark modules also available. Glow in the dark is like you put these modules, ask the patient to go home at night, 12 a.m. at night. Switch off all the lights in the room and come in front of the mirror. It'll look like everything will glow like this. Yeah, there's a glow in the all sorts of innovations going on in this one concept called elastomeric modules. Guys, end of the day, this is all mindset. This is all that donkey, that one call from that female, that way you think is what matters. Orthodontics, fixed orthodontics is just that. Have an open mind whenever you read any textbook on orthodontics. But for NEET preparation, I strongly recommend attend classes. Reading a lot of orthodontic textbooks may not take you anywhere, unlike other subjects. Listen to more and more of these kind of videos. You get more and more of questions answered. Be ready for a change.